Hi, I'm Dr. Bhargav Raut from Pathofast Lab in Pune. Patient often asks us what is the name of the test for pregnancy. Well, there are two types of tests for pregnancy. One is the blood test. The name of that test is the Serum Beta-HCG blood test or the Beta-HCG blood test. The urine test is also done to check the level of the same hormone, which is called Beta-HCG, and the name of the urine test is the urine Beta-HCG blood test or the urine pregnancy test. Both these tests check the level of a hormone called Beta-HCG in your blood. This hormone is made by the connection between the mother and the child, which is called the placenta, and it is a sign of pregnancy because this hormone only gets raised, elevated or created mostly only in pregnant women. When should you do this pregnancy test? You should test immediately after your first missed period. It's important to remember that the blood test is far more accurate and can detect the pregnancy earlier. The blood test is usually positive around 10 days to 2 weeks after conception. That means after the sperm and the egg have united. The urine test is positive a little bit later. Both tests can give false positive results, and both tests should be repeated at least once for confirmation. What are the normal expected values of Beta-HCG if you're pregnant? It's important to note that only the blood test will actually give you a number or a result or a value. The urine test will only give you positive or negative. The blood test has different values depending on how many weeks pregnant you are. If you're not pregnant, the value will be less than 5. Usually it's 0. If you're pregnant, the value will go on doubling every 2 days for the first 3 months of pregnancy. The value is usually measured in a specific unit called international units, and this is only available through specialized machinery and technology, which is only available in labs, in diagnostic labs. I've created a separate video on the different normal levels for this value per week. Please check that video. I've linked to it in the description. There are also available home urine tests, which are basically called urine strip tests, where you just add a couple of drops of your urine to the strip, to the test strip, and it will give you either 1 line or 2 lines. 2 lines if you're pregnant, 1 line if you're not pregnant. These tests are convenient, they're cheap and they're easy to use, but they do have their problems. For example, if you drink a lot of water before doing this test, you may test false negative. There are also other problems regarding how much is the minimum amount of Beta-HCG that they can detect. I personally always recommend that you do the blood test in the labs. You can do the urine test if you're not at home, if you're not in your usual place of residence, if you're in your office, or if you're short on time. But for confirmation and for further monitoring, always go in for the labs which do the blood test. How accurate are these tests? Well, both urine tests and blood tests are nearly 99% accurate. All their manufacturers will always claim that they are very accurate. What's important to remember is that there are possibilities of false positives. There are many situations in which you can have a false positive pregnancy test. There are situations in which you can also have a false negative pregnancy test. The best way to confirm your pregnancy is to repeat the test after a couple of days or a week. As I already mentioned, if you're really pregnant, the value will go on doubling every 2 days. So the doctor will just compare the time between your first blood test and your next blood test and try and correlate whether it is really doubling every 48 hours. In addition to this, for further confirmation, you should go in for an ultrasound scan, which will also show whether you are really pregnant. But it's important to note that on the ultrasound, pregnancy can only be seen after around 5 to 6 weeks, whereas the blood test can show you as early as 2 to 3 weeks.